Great. So I'll start again. Apologies that I didn't come through before. I'm going to start again. Sorry for the lost time, but we don't have a lot to cover. I'm sure we'll get through it in the allotted time. Thanks for everyone for tuning in. It's really a great privilege to share with you what I can about this topic, which is very, very important. We've already received a lot of questions ahead of time, and I'll try and cover all these. I'll cover these questions that have been sent in already, and if you have any more, please send them through, and I'll try and cover them all in the time we have today. My name's David Wechsler. I'm an ophthalmologist working in Sydney. I see a lot of patients with glaucoma, and I also work with Glaucoma Australia on our expert advisory panel. And I've been doing a lot of work with our submission to the Ostroads about the current driving guidelines. An outline of what I want to cover today. I'm going to discuss how glaucoma can impact driving, talk about visual fields and how that relates to glaucoma, its impact on driving, and also how it relates to the driving assessment and regulations. So first of all, how can glaucoma impact driving? A couple of basic points to start with. Glaucoma is optic nerve damage, and as the nerve gets damaged, there's progressive loss of what we term the visual field. But what this really means is our peripheral vision, and we measure that when we're doing visual field tests in the clinic. As people start to develop glaucoma, there are blind spots in the vision. We use the term scotoma. It just means a bit in the vision that's not seen quite so well. These scotomas, or areas of peripheral vision loss, are often asymptomatic, and our brain fills in the gaps. Glaucoma generally occurs in older people, and sometimes there can be a combination of problems with the vision and then other problems of physical and medical conditions, which can lead to decreased reaction time and can impact on people's ability to drive. At the end of the day, driving is a complicated task, and vision's just one aspect of it. Our other senses are important, as well as memory, concentration, judgment, and our physical capacities. I often find it's hard to explain, and I often ask my patients, what do people with glaucoma actually see? This picture I've put up here from an overseas website shows a fairly conventional view where we assume that glaucoma is a loss of the peripheral vision, and it's almost like a tunnel vision, or the vision closing in. However, I'm not sure if this is necessarily an accurate projection of what an accurate depiction of what people with glaucoma actually see. The scotomas, or the blind spots, these blind spots are often not appreciated, and our brain fills in the gaps. So many people with glaucoma are not aware of what they're not seeing, and things just appear out of nowhere. Sometimes I ask people, and if they've tripped on things or fallen over, I say, do you think the vision's part of it? They say, oh, no, I just didn't see it. So you're not aware that there's a bit missing in the vision, but things just appear. This diagram gets put up a lot. It's from work in the UK, but I think this maybe is a better depiction of what people who are affected by glaucoma might see. So on the left-hand side, there's a scene, and this is on a road. There's a ball going out in the street, and there's some children playing on the side. And on the right is a picture of what someone with glaucoma might see. They're not aware that they don't see the children, but their brain just fills in the gaps and just shows a continuous street there, and they're not aware that they can't see. When we do visual field testing, we're trying to detect areas in the peripheral vision where the vision is less sensitive. In an extreme case with advanced glaucoma, it might be a complete blind spot. But in the earlier stages, it's areas where we just don't see things as well, and it's not a complete blind spot. Here's a picture of my lovely assistants doing a visual field test. For those of you watching who do have glaucoma, this will be something that's familiar to you. It's the patient, or the subject being examined, sits with their head in the bowl, and some lights are presented, and they're instructed to press the trigger when they see the flashing light. And from this, the computer then generates a map of what the peripheral vision might look like. This is a patient with optic nerve damage. This little spot of blood here shows an area of where the optic nerve is currently being damaged. And this is the visual field printout showing an area just here, which corresponds to where that little bit of the optic nerve's not working properly, and that's a little blind spot in the vision. Now, this patient might not be aware of it themselves, but when you actually test that point in the peripheral vision, there's a little blind spot there. This is the more standard peripheral visual field test that we use when we're monitoring glaucoma. This is one of my patients. This is the map of the left eye visual field, and this is the right eye. And we can do the visual fields over time to see if the blind spot's getting any larger. Now, this patient's very stable in the left eye. Nothing's gotten worse over time. These fields were done a number of years ago, and this is the most recent one now. And this is the right eye, which is not as affected, but there is the start of visual field loss starting in on the right eye and then gradually progressing. So there's more damage here on the left eye, as indicated by the black spots. The right eye started off normal and starting to get a little bit of visual field loss, and they're being actively monitored and on treatment. And this is one of the ways that we assess whether our treatment is slowing the disease down enough, whether it needs to be increased, or whether the patient is stable. Now, when it comes to driving assessment and the current guidelines, there are a number of criteria. Firstly, there's the visual acuity criteria, which is the vision on the chart. And this is something that's not usually affected by glaucoma, but it can be affected by other diseases. And that's important that you can able to, that's our reading vision, the vision on the chart. Then there's the visual field criteria, which I'll go through. And because glaucoma can affect the peripheral vision, that's a very important criteria for us to be thinking about. Another criteria is that of double vision. I put that in brackets because it's not something I want to deal with at length. Glaucoma generally doesn't cause double vision, but other eye conditions can. So if someone's got double vision, that's a big issue for driving. And so when you go to get assessed for driving, you need to pass on all these criteria. You have to have good vision, be able to read the chart. You need to have enough peripheral vision that you can see objects, and you got to not have double vision or only have a tiny bit of double vision in one area. So these are the things. These are the things that we look at in driving. But as I said, I'm not going to talk too much about double vision because it doesn't really relate to glaucoma so much, but just something to be aware of. That's another thing that impacts. Now, I often get people saying to me, oh, look, I know someone with one eye and they're still driving. Now, you can drive with one eye if you have an intact visual field. You have good peripheral vision. And the assessment is based on both eyes being open at the same time. But if one eye is good, it has one eye is normal, has normal vision, has normal peripheral vision, then you still meet the criteria for driving. Conversely, if someone has two eyes, but they're both got a lot of problems with the vision and the visual field, that can actually be an issue. So in some aspects, in the eyes of the guidelines, one good eye is sometimes better than two bad eyes, or two not so good eyes. I'm going to go through the driving guidelines and get to the questions, but I'm just going to say a few generic things about the driving guidelines. There's two standards. There's a private standard and a commercial standard. So the commercial standards apply to people that are driving a heavy vehicle, that are driving taxis, buses, or trucks. Those standards are more stringent, and you've got to have better vision as well as other capacities as well. We won't talk about that too much, but just be aware that if there's any peripheral vision field loss, that can be a big issue if someone has a commercial driving license, if they're driving a taxi or a truck or a bus or something like that. We'll deal mainly with the private license, which just means the normal car license standards, which there is a little bit more flexibility. Now, the national standards are the same throughout Australia. So there's one set of guidelines. There's one set of guidelines that's developed by Onroad, which applies throughout Australia. However, it's each state that individually administers it. So, for example, I'm in New South Wales, it's the Road and Maritime Service in New South Wales. In Victoria, it's Vic Roads. In other states, there'll be state-based bodies that are responsible for your driver's license. So they administer these guidelines, which were developed nationally. And it appears to me that these are assessed and enforced slightly differently in each state, even though the rules are basically the same. It's also worth mentioning that the current guidelines get reviewed every few years, and they're currently undergoing review. Okay, so there's a panel of experts that are reviewing the guidelines, and then I would anticipate that at some point when this process is finished, maybe later this year or next year, there'll be an updated version of the guidelines released. Okay. But what I'll do is I'll talk about the guidelines as they currently stand, and the current guidelines have been in place for the last 3 or so years. So I've already mentioned this, but I just want to spell it out again. There's a difference between what we call the visual acuity, which is the reading on the chart, and the visual field, which is the testing of the peripheral vision. Because a lot of patients with glaucoma come in and they can read the visual acuity fine, and then they can't understand sometimes why there might be a problem that could impact on their driving. The visual acuity is very important. You need to have better than what we call 612 or better. If the vision is below this line on the chart, then you can't drive. But usually, if the problem is only glaucoma, then the visual acuity isn't an issue, unless it's really bad glaucoma, in which case there's going to be a lot of issues with the driving anyway. It's worth making the point that only the central 1% of our visual field is tested by the chart. So the visual field test is really very, very important. Okay, reading the chart's not enough if there is peripheral vision loss from glaucoma. The other thing about the visual field is that the visual field test for driving, even though it's the same machine like what I showed you before, it's a slightly different setting on the machine, and it tests a slightly different thing. It tests a wider degree of field, and it's done with both eyes open at the same time. So that is very different to the normal testing we do, which is done on each eye separately to see if the glaucoma is getting worse, to know if our treatment's working or not, or if our treatment needs to be increased. This is an example of a patient who's got quite a lot of visual field loss in their left eye and a moderate amount of field loss in their right eye. This is the 24-degree field, which we use for monitoring them, just for checking their glaucoma treatment. But when they come for their visual field, for their driving assessment, they need the visual fields done at the same time as their driving assessment form, we do the so-called binocular estimate test, which is the same machine, but it gives a different printout. It's with both eyes open, and it's testing a much larger degree of field. So these axes here go out to 80 degrees either side. It's testing 160 degrees the whole way across. Whereas these ones that we use for the normal glaucoma testing is testing 24 degrees, which is where a lot of the action in glaucoma takes place. Sometimes you can look at that and say, look, this looks terrible, this field. But when you actually put this together, most of the central field is actually still intact with both eyes open, and this patient actually fulfills the current guidelines for driving, despite their glaucoma and despite moderately advanced glaucoma. And the reason is because those black spots here in that eye are compensated by these white spots here. And they've got enough of the peripheral vision with both eyes open there. There's a little bit missing there, there's a little bit missing there, there's a tiny bit missing in the middle. Okay, but that's not to say this is normal, and it's not to say this patient isn't even at slightly increased chance of having an accident, especially as they're an older person, they might have some other medical problems as well. However, the line has to be drawn somewhere, and this person's visual field does satisfy the current guidelines, and they get passed for their license. So what do we know about glaucoma and driving? We know that the risk of an at-fault collision goes up with the degree of visual field loss. And we know that if you've got a binocular overlapping visual field loss, that's worse, okay? You could be missing the top half with one eye and the bottom half with the other eye, but you put the two together, you're basically okay. And that can happen in glaucoma. But if you had the top half missing in both eyes, that would be a significant blind spot up the top. It's thought that maybe lower field loss is more risky than upper field loss. And we also know the risks are compounded if there are other issues and medical comorbidities. driving is a very complicated task and multiple factors can be involved in an accident. And so it can be difficult to tease out the individual factors, but these things all sort of add up. A big issue with the guidelines is that the current evidence is not entirely clear at what point we draw the line. What degree of visual field loss does the risk become unacceptable? We know that the more peripheral vision you lose, the more chance of having an accident, but it's hard to know exactly at what point to draw the line. But nevertheless, the guidelines have to draw the line somewhere, because otherwise it's very difficult to administer this. The current guidelines, you need an acuity of 612 or better with both eyes open. That's fairly straightforward, it's reading the chart. And with the visual field, you need at least 110 degrees across with 10 degrees above and below. That's one point. You need 110 degrees across. The other point is you can't have a cluster of 4 or more points within. So this is a binocular estimate field like what I showed you before, and we've drawn on what you need. You basically need to have a certain amount. You don't have to have the whole thing, but you need to have a certain amount intact there of 110 degrees. And within the central 20 degrees, because the central field is more important, you can't have a large blind spot with 4 or more points. Now, this patient does have an intact visual field, so they can walk around without bumping into doorways. They're actually not that affected by the glaucoma in terms of what they see themselves. However, on testing, there is this scotoma or blind spot in the middle, which has got more than 4 points. And it's deemed that within this central 20 degrees, this area is more important, and you can't have a blind spot that's big enough in the middle because that is thought to be at increased risk of a collision. Now, this is where the current guidelines are at the moment. So it's just putting this up just to illustrate where these guidelines are at the moment. So I already mentioned, I'm going to deal now with the practical considerations, that the administration varies from state to state. At the end of the day, it's not up to the doctor to say, or to take away people's license. Okay, it's up to the driver's license authority. However, they rely on what the doctors or what the other health professionals put in their reports. And it's actually up to the driver in most states to tell the driver's licensing authority if they have a vision problem that may affect their driving. For all of us, when we renew our license, it says, do you have an eye or vision problem? Okay. Now, health practitioners do not necessarily have to report the patient, except for South Australia and Northern Territory, where they do have mandatory reporting guidelines. So if there's anyone listening who's in South Australia or Northern Territory, if you go to the doctor and you have the testing done and the testing shows that according to the current guidelines you shouldn't be driving, those practitioners actually have to inform the driver's license authority. In the other states, it's up to the patient actually to then tell the driver's license authority, but it's up to the doctors and the health professionals to tell the patient, we think you shouldn't be driving. Okay. Now, there is what we call discretionary reporting, so that if someone goes to the health professional and it's clear that their vision is very bad and that health professional feels that they're a danger to themselves and to the public, then they are protected if they then do decide to inform the authorities that they think this patient is a risk because they acted in the public interest. Because there is confidentiality issues. So the neatest thing is if I'm the doctor or my colleagues, if we see someone, we say, look, I don't feel you should be driving. I'm telling you, this is the guidelines. You shouldn't be driving. I'm not going to tell anyone else because what happens between us is confidential. However, you shouldn't be driving and you should tell the driver's licensing authority, then you should give up their license. That's essentially how it should happen. Now, there's all these different scenarios that can happen and things can play out in different ways, which we might get into in the Q&A. But that's kind of what the rules are at this stage. Now, each state has different mechanisms, and this is the one I'm most familiar with because I'm in New South Wales. When someone turns 75, they'll get a form, and the form has to be filled out by the health professional. And that's the way the driver's licensing authorities can find out this information. But it's at the end of the day up to them to enforce it. The other thing is, and I always tell this to patients, this is a legal issue. That the forms that come from the driver's license authorities are legal documents. And also, when people are driving, if, for example, if they have an accident, things end up going to court, there's a whole lot of legal issues around this. And so often, for example, records can be subpoenaed, and people can find out if there is a vision problem or not. And it becomes very important what was said, what was told to the patient. And so I think sometimes it's never easy telling patients that we don't think they should be driving, as I especially because they sometimes don't think they've got a problem, because a lot of people with glaucoma are asymptomatic, they're not aware of the visual field loss. And these are the issues that come up, and it can be challenging. But I hope that by at least talking about what the guidelines are and how they're assessed, that it can be clear to people why some of these things come up. In New South Wales, there's an annual driving medical form that happens once people are age 75. Every year the form will come, and there's a section on vision. In some younger patients, if they have other conditions, they will have to do the form earlier. Other conditions like diabetes or epilepsy. Sometimes if the New South Wales Roads and Maritime know they have glaucoma, they might ask for this beforehand. But it's usually when people hit the age of 75, these forms come, and that's when some of these things get flushed out. The rules are the same if someone's less than 75, but prior to the age of 75, the onus is on the patient to declare the condition. So this comes as a general medical form the GP can fill out, but there is a specific vision section where it states if an eye or vision condition is present, it should be filled out by an optometrist or ophthalmologist. And that's because it's very difficult for the GPs to formally assess the visual fields. And other sections of the form also need specialist input as well about the various conditions. If someone does not qualify, if they don't meet the guidelines, the doctors can make recommendations, but it's up to the driver's licensing authority, so in New South Wales, the RMS, what action is taken. There can be further testing done, but they do go a lot on the estimate visual field, which is the visual fields that I've outlined. We can make recommendations for a conditional or restricted license, but it's up to the driver's license authority. Ultimately, it's not really for the doctor to say. We can ask for it or suggest it, but at the end of the day, it's up to the driver's licensing authority, based on the information that's provided to them, whether they'll accept that. Okay, we've had a few questions about that, so I'll talk about that in a minute. Just want to talk about a few areas of controversy, and I don't want to make things too complicated, but I wanted to mainly stick with what the current guidelines are and how we deal with them, and how to help patients with the current guidelines. But there are areas of controversy by means of background. There is a body of literature evolving here and overseas, trying to look at what's the level of vision problem that puts people at a high risk of an accident. Part of the issue with doing these studies is that the methodologies will vary. There'll be all these different studies that have looked at slightly different things in slightly different ways, and sometimes the findings are inconsistent between the studies. So at the moment, the perfect study hasn't been done yet that says, right, you have to draw the line here, and if the visual field's better than this, they're fine. If it's worse than this, they're a menace to society, don't let them drive. It's just unfortunately not that clear cut, but when people are designing these guidelines, they have to draw the line somewhere. The current assessing fitness to drive guidelines, actually, this is a quote taken directly from the guidelines, which it says, methods of measurement of visual fields are limited in their ability to resemble the real world driving environment, where drivers are free to move their eyes around. And so, you could say, well, if I can move my eyes, and if I can react well, and if I'm otherwise compensating very well for the visual field defect, then I might not be at increased risk of an accident. And I'm sure in many cases that is the case. So, but the testing is limited that we have to really nail down exactly what happens in the real world. But at the moment, that's the best we have. People are looking at alternatives. And in the future, I'm hopeful that when there's better evidence base, when there's better studies that have been done, that we may get perhaps the system may be slightly different in the future. I can see why it's attractive for a distinct cutoff, however, in terms of implementing. sometimes when we're dealing with thousands and thousands of people, and that the licensing authorities have to sort of deal with this, they have to draw the line somewhere. And it is attractive to just have one test that says yes or no, if you pass or you fail. Okay. So I can see why that's the case in terms of implementing. However, we believe there should be some wiggle room, that especially because the evidence that out there is a little bit contradictory in terms of where to put this cutoff. And there was a question that came about this already, that alternative methods of assessment should be looked at as well. That the visual field test itself, the Esterman test, even though that's the easiest for us to perform because we've got it in our rooms, maybe that shouldn't be the be all and end all. Okay. Other potential forms of testing include on-road testing. So in the past, there have been occupational therapists and orthoptists that have specialized in driving assessment and vision and driving disorders, which have actually taken people on the road, assessed them. These on-road assessments are no longer currently done and are currently actually prohibited under the current guidelines. It was thought that there might be safety issues with that. However, potentially in other jurisdictions, overseas, this is something that's still done. And perhaps with the suitable guidelines for who you can and can't do a testing on, maybe it can be done in a safe way. Criticism of this is that it still doesn't resemble real world conditions because it's an artificial test. And this is always going to be an issue with some of these testing. But it's still, as Glaucoma Australia and the panel of us, we've submitted to the guidelines that it's something that should be looked at again if it can be. In this day and age with increasing technology, the possible use of simulators might be another way, or even a combination of this, putting someone on a simulator first before putting them on an on-road test to see maybe what they're like in the real world as opposed to what they're like just on the visual field. Okay. And then these are areas that are being looked at in terms of the literature on driving safety and vision disorders. There are also other visual field testings than the one we've talked about. There's a Goldman test, which is another type of visual field test. That is different because it's a moving target, and some could argue that a moving target might be more relevant to driving than what we call a static target, which is what the normal visual field testing we do in clinic is. And another thing to look at is what we call just doing the Esterman test, but what we call a roving Esterman, which is doing the same visual field test, but allowing the patient to move their eyes, because maybe this might resemble what the field loss is like when they're driving in actual real life. And there is some provision in the guidelines for the driving licensing authority to look at this, but the actual main criteria is the static Esterman test, the normal visual field test with both eyes open, where the patient has to look straight ahead and allowed to move their eyes. So that's the main thing that they've come down on. There's provision that they can look at the other ones, but they've not said at what level they'll pass or fail that. They've given a level that they'll pass or fail for the normal estimate, and these other field tests they might look at. So there's a bit of a grey area there. Okay, that's the end of my presentation. So we've still got quite a bit of time, and I'd like to get to the questions. We've got a few questions that have come through already. So I'm really thank everyone for their questions. If you just give me 2 seconds while I have a quick read of this. Now, I'm just going to quickly run through these ones that we've already had and then get to the ones that have come through while we've been talking. So firstly, why can glaucoma affect my vision or drive for driving? Hopefully I've talked about that in the presentation already, that the glaucoma causes peripheral field loss, but you're often not aware of it, and the brain fills in the gaps, and that's very important because it puts you at increased risk of an accident. How would I know? This is very important. Sometimes people with glaucoma don't feel they've got any problem because the brain fills in the gaps, and so they might not see things, and sometimes you won't know, and that's the problem. What tests are done to test my vision for driving? If you're in New South Wales and you get the form, or in other states there'll be a similar mechanism, you need to test the visual acuity, which is reading the chart, and it's the visual field with both eyes open. You need to have at least 110 degrees. The rules different for each state and territory. So as I've said, the rules are the same, but the way it's assessed and enforced is slightly different. And I know from speaking to colleagues and in fact patients that often go interstate, sometimes the enforcement is possibly a little bit less strict in some of the other states, but the rules are actually the same. The other thing is that in South Australia and Northern Territory, if you see someone and the health professional feels that you shouldn't be driving, they actually have to tell the driver licensing authority, whereas in the other states it's not quite like that. What is a conditional driver's license? So if someone doesn't meet the criteria for an unrestricted driver's license, the doctor can suggest a conditional license, and then they have to put conditions on it. So sometimes this is arbitrary. Often with the patient, if someone's got a field loss from glaucoma and they don't meet the criteria for an unrestricted license, I will limit them and suggest no night driving and just staying in a radius of within 15 kilometers of home or something like that. The rationale for that is definitely the vision is worse in people with field loss at night, so there is some rationale for that. The rationale of restricting the radius is possibly not so evidence-based. I mean, someone can have an accident just as easily within 5 kilometers of home as they can if they went 100 kilometers away. I mean, presumably if someone's not driving on freeways, they're at less risk of a high-speed accident. And I think from my own experience, certainly the RMS in New South Wales is not so keen on this unless there's a real specific justification for why to do it. But often when a patient first comes and there's an issue with the not meeting the criteria for driving, sometimes trying to go for a conditional driver's license is a way of showing the RMS that we've taken into account the fact that there is a vision problem and reducing the driving, therefore reducing the chance of them having an accident. How often do I have to be assessed for my driving vision? Well, in New South Wales, it's every year once you turn 75. For the other states, it may be different. And prior to 75, when you renew your license, the driver's licensing authority will ask you, is there a problem? Now, it's up to you whether you tell them or not, but then that's on your conscience if you're sort of forthcoming with that or not. The onus is also on the health professionals to tell you if we think that your vision is at the level where it could be an issue for your driving. But in the reality is when we're all busy and we're seeing patients and we're talking about the treatment of the disease, sometimes that can get missed until the actual form comes. I'd like to thank the person who sent in the next question. Under which circumstances does my ophthalmologist have to take away my license, and what steps do they take for this? So this will vary from state to state, but for the most of us that aren't in Northern Territory or South Australia, it's not up to the optometrist or the ophthalmologist to take away your license. And here's the thing, I mean, we're here to help you. We're here to help the patients. And predominantly we're here to treat the condition and help you do the best you can with it. And sometimes this can become very adversarial, and really it's between the driver and the driver's licensing authority. Sometimes we're in the middle of it because we're doing this testing, and as I said before, we can make some recommendations, but it's not really up to us to be judge and jury. We can advise what the guidelines are, we can advise what the level of vision is, and in some cases patients have then sort of had to argue their case with the driver's licensing authority. But as I said, it's not really up to us to take away your license, with the possible exception of Northern Territory and South Australia. Okay. Now, this last one, I've got a friend with glaucoma who can still retain a driver's license but has given up driving voluntarily due to a loss of peripheral vision. Do all glaucoma patients need to consider this? Well, it depends on the extent of the loss of vision. Okay, it depends if it's in one eye or both eyes. It depends at what degree it's progressing. Most people with glaucoma don't go blind. Many people with glaucoma can maintain their license. If someone presents with very advanced glaucoma in the beginning and they've already lost a lot of peripheral vision, then it's very difficult. So glaucoma is a spectrum of disease. Some people have it mildly, some people have it more severe. And it's something, if you're worried, you should talk to your specialist about when you see them and when you have the visual field test, and ask them, is this something that's likely to impact on my driving? I had a patient that I did surgery for yesterday. He still maintains adequate vision for driving, But I looked at his age, and I looked at the fact that he's getting worse. I know he drives. I know he doesn't like using the drops, and his pressure wasn't where we wanted it. And I said, look, in the future, if this keeps going the way it is, when the form comes, we want you to still have better peripheral vision, that you'll pass this. So we then took the step to do surgery, get the pressure lower, to slow things down more than what we have done with the drops, so that hopefully he'll maintain enough peripheral vision so that when the form comes, when he turns 75, he'll still be able to keep driving. I'm just going to stop the screen sharing on this one here, if I can find it. And I've got some more questions to deal that have been sent through while we're talking. Okay, leave it like this. So the question that's come through now is, I'm worried about losing my license. If I skip my appointments, does that mean I can keep renewing my driver's license without visual field loss detected? Now, I really thank the person who sent this in, because this is something that happens. And it's what I mentioned, it's very unfortunate that sometimes we're in this adversarial position with the patients where they don't want to come in, they don't want to have the visual field test in case it shows a problem that will impact their license. It depends what state you're in. For example, if you're in New South Wales and you're getting close to the age of 75, there's no way you're going to be able to avoid this, because when you're 75, that form will come and you'll have to get it filled out. You can try with your GP or your optometrist. The optometrist will do a visual field. GPs now should know that if there is a vision problem, the vision section should be done by the optometrist or the ophthalmologist. Theoretically, if you did skip your appointments, then you might not get your license cancelled. But the big problem with that is that you're not getting the glaucoma treated, and things could ultimately end up worse than they would have been. So while it's unfortunate that this could be an issue, I have to advise that you have to keep going with the appointments, because there could be a difference between you going blind from glaucoma or not. If the glaucoma is that bad, so because the glaucoma is that bad. So, I think it's important to speak to the doctor about the issues you're having. The doctors can go into bat on your behalf, and I know I have. There's those other testing that I said. They can make a case for a conditional license, and then it's between you and the driver's licensing authority whether they do it or not. But at the end of the day, if you're doing yourself a disservice if you don't get the glaucoma treated, because once you lose vision from glaucoma, you can't get it back. Okay, now we've got a question from Sarah. At what age can children start getting visual field tests? It depends. There's no blanket rule on this, but it's late teens. But it depends on how good the child and cooperative they are they're doing it. It would probably be late teens. You wouldn't do it early teens. The issue of driving is not going to be an issue until they're 16 anyway. By the time they can start doing their L's and P's, they can probably do a visual field test. Okay. Also from Sarah, will they test for visual fields when getting a learner's driver's license? Actually, this is the sort of thing, I don't see a lot of kids myself, and it's been a while since I got my learners. They actually don't. But I think if there is a child that's got a childhood glaucoma and they are going for their learner's license, the rules still apply. So even though the driver's license authority are probably not clued up enough to test this, I think the responsible thing to do is do a visual field test on the 16-year-old. I think a 16-year-old, if they're cooperative enough to learn how to drive, they'd be cooperative enough to do the visual field, and they should do that. And then if they're presumably this 16-year-old child is on treatment or under a specialist, this should also something you should discuss with the specialist, because even if the field's good enough now, this could be something longer term that could impact on their driving, and it's worth looking at now. Okay. From Anne, and I'd like to thank Anne for this question as well. I lost my license because I have 4 squares missing in the center of the estimate test. I still can't understand the reasoning. Thank you for the question, Anne. I've got patients with the same problem. I'm going to go back to this slide here, which is actually one of my patients who had the same thing. This patient's actually got quite bad glaucoma. The peripheral vision is okay, but there's a scotoma here of more than 4 points within the central 20 degrees, and the RMS have cancelled their license. At the end of the day, that's a rule that's in the current guidelines, and that rule's there. And we have to deal with it. We can't get around it. The reasoning for it is that if someone only has one eye, there'll be what they call a physiological blind spot, a normal blind spot. But 4 points is more than that. So if I take you back to someone with like a normal field, this is someone here. This is a normal blind spot in an eye with an intact visual field. So if someone's only got one eye, if you've got both eyes together, you don't see the blind spot. But if you've only got one eye, you will see the blind spot. But so they've made allowances that you can have a small blind spot in the middle, but you can't have a large blind spot in the middle. There is some evidence, although not all the studies show this, there is some evidence that if you've got that the central vision is more important for driving, and that if you've got a large blind spot in the central vision, that puts you at increased risk. There are other studies that don't show that. I've argued the case that if someone can move their eye sufficiently, and this same patient, if you test them again and allow them to move the eye, that spot will be much smaller, that they should be permitted perhaps a conditional license. And look, this might be one of those cases which I sort of talked about before, where if you could put them on a simulator or an on-road test, you might find that they can see everything they need to see in the environment, or even doing the test with a moving target, that they might be able to see things that it might not necessarily put them at increased risk of an accident. So, Anne, I sympathise with your predicament. I've had patients who've had the same problem and had their license cancelled. And at the moment, that's a rule that's in the guidelines that we have to contend with. And I'm going to wrap up shortly, but I think there was another question. Oh yeah, and this just leads into a question that we had from Lynette. You sent this in before. Lynette said, if we fail the binocular visual field test for driving, can we appeal to have a restricted license? And we want to know if there's a process. So Lynette, that's an excellent question. And Glaucoma Australia have written to the Onroads on all of your behalf, saying that we want to have a more clearly set out, defined process. What happens if someone fails this visual field test? Okay, because at the moment there's a little bit of wiggle room, but not much, and they're not clear how to go about it, and it's not clear at what point in the other visual field test they would then consider it. So that's something that we've very strongly made representations to about on behalf of our patients, because I think there's nothing worse than one, people having to cancel their license, and two, not knowing what to do next. So that's something that we're looking into and campaigning, because I honestly think it's going to be difficult for us to make any significant changes to the guidelines, but at least that there be a fixed process for what to happen for people in this situation, where it might not be so obvious that there's a massive problem, but they're just somehow falling just short of the guidelines. So look, I'd like to thank everyone for all the questions they've sent in. It's really covered everything that I wanted to cover about this topic. It's important, and I hope that it was helpful to people. And thank you for all your questions. And please enjoy the rest of the presentations as part of that we're doing as part of World Glaucoma Week as well. Okay, thanks very much.